Prostate cancer remains the most common non-cutaneous malignancy among men in the world. The availability of new tests that are being done, such as routine screening tests, which includes PSA, and multi-parametric MRIs, allow us to diagnose gentlemen with prostate cancer at a much more earlier stage. A new and evolving field in medicine, not just urology and not just in the treatment of prostate cancer, is focal therapy. Over the last few years, probably it was the last 10 years, there's been a new interest in focal therapy, especially with the introduction of new technologies that we have available. So basically, focal therapy involves us giving specific energy to the area of the prostate gland that's involved. And basically, HIFU uses high intensity frequency ultrasound. It heats up the tissue and causes coagulative necrosis. Now, coagulative necrosis essentially just means we are burning the tumor away. The unique and special thing about HIFU is when we give the energy, it travels and it's particular one area in the prostate gland and it burns that area. HIFU is a treatment that allows patients to remain potent, as in they have no risk of erectile dysfunction. There is no risk of urinary incontinence. It is a procedure that is done generally over a few hours, so patients can get admitted in the morning. We tend to do it under general anesthesia or even spinal anesthesia. After the procedure, patients are sent home with a catheter. There are certain situations where patients have quite large prostate glands, but the area that is involved is just a small area. So we just burn that area. And to make patients not have urinary symptoms after the procedure, we also do a TURP, which is a transurethral resection of the prostate. Now, the wonderful thing about HIFU is these patients come back and they follow us up. They will notice that the PSA goes down significantly well. So the aim of treatment now, especially in medicine, is what we call as being precise medicine. And we want patients to return to function as soon as possible. HIFU allows us to do that because they've got no scars on their body. Immediately after the surgery, they can eat and drink. But the important thing about HIFU is choosing the right patient for the right treatment. There's no one treatment that fits all, and this exciting, evolving field of medicine now with focal therapy especially, it allows us to prolong patients' life, treat their cancers, and more importantly, allow them to return to function as normal. This is important, but as I mentioned now, with patients going for health screening, patients can go anywhere and get a blood test done. A PSA is a normal blood test that's offered in a lot of health screening programs, and you get younger and younger patients being detected earlier and earlier. So, for example, a patient that we recently had was only 50 years old. He came for a health screening, he noticed his PSA was slightly elevated. What we do in Ireland is we perform an MRI of the prostate. A multi-parametric MRI allows us to look at the whole prostate gland and identify areas that are suspicious. Once these areas have been identified, we perform biopsy. So after we've reviewed the histopathology, so the patients who fall into the low risk and intermediate risk generally have very low PSA, and the tumors that we have sent to the lab have come back as what we call very low-grade tumors. Patients with low-grade, low-risk prostate cancers actually do very well. If we were to offer these particular patients something like surgery or radiotherapy, so it's a bit of an overkill, and that's where focal therapy has a place. I think it's a very exciting new field. It must be noted that if you look at the guidelines, there's strict guidelines about focal therapy. It should be only conducted in centers that are part of a clinical registry. So what that means is any patient who we subject to HIFU, we include them in our clinical registry. They are followed up very closely, and it is of note to inform the patient that this is part of a clinical registry and not trial. In the future, with more and more technology that's coming out, the treatment of prostate cancer will be evolving, and it's a very exciting field. And I think I'm very fortunate that in Ireland, we are the frontiers. We are the main hospital, I would say, in Malaysia perhaps, or even in Penang, that offers all options of treatment.